Hey guys, today I want to talk with you briefly about neck pain. Specifically, I'm talking to those of you in perhaps a high stress job, maybe a desk job, a computer job that requires you to spend long hours at the computer. These are things that predispose to neck pain, and a large percentage of us in these kind of jobs are currently. Hey guys, Ryan Davis. Today we're talking about neck pain. Specifically, we're talking to those of you that have high stress jobs, or maybe you have a job that requires you to sit specifically at a computer for a long period of time. We're going to talk about a few different topics related to neck pain. Number one, we're going to touch on the true cost of pain in the workplace. We're going to discuss briefly some risk factors that can predispose you to neck pain. We'll talk specifically about how I, as a chiropractor, can help you with your neck pain. And then we'll touch on four things that you can start today to improve your neck pain. So, the first thing we want to look at is the true cost of pain in the workplace. And this is not specifically neck pain, but neck pain, back pain, musculoskeletal pain, and the effect that it has economically on the workforce. So these studies were done in the United States only. So these numbers are specific just to the US. In the US, it's estimated that the cost of pain is $635 billion. Now that's just the direct cost. That's the cost of missed time at work, the healthcare cost associated with treatment. But if we add in this term presenteeism, which is essentially when you show up for work, but pain has a negative impact on your performance, on your productivity, we'll call that presenteeism, and that estimated cost is around $1.5 trillion. So a massive impact on the workforce when we're dealing with pain and experiencing pain. So what are the risk factors? These are some of the risk factors that have been shown specifically with neck pain to correlate to a high degree. Number one is spending more than 6 hours seated at a computer. So 6 hours, just talking to my patients in DIFC and in Dubai in general, 6 hours is not a lot compared to what a lot of you guys are doing. But spending that 6 hours a day can drastically increase your chance of having neck pain. Number two is just being a female. So females tend to have a higher incidence rate of neck pain over males. Not a lot we can do about that. Number three, and this is huge, is stress, stress, stress. So having stress not only correlates to an increased probability of having neck pain, but it also amplifies the neck pain. You can think of stress essentially as a volume knob on your discomfort level. So maybe that one or two kind of nagging neck pain is now a three, a four, or a five due to the stress that is associated with our jobs. And number four is just having a reduced range of motion in the neck. So it's been shown that if we don't have a full range of motion, maybe we can't touch our chin to our chest, or we don't have a full 90 degrees of range of motion, this as well will predispose us to having neck pain. So how does a chiropractor specifically go about treating neck pain? Now, of course, we're going to start with, a detailed history taking, orthopedic exam to identify specifically what's the pain generator at play. Perhaps it's joint pain, perhaps it's muscle, nerve, or disc pain. We want to know exactly the tissue that we want to target because it does dictate what we're going to do as a treatment. But speaking just generally, we'll talk about joint mobilization. So this is what most people think of when they think of a chiropractor, but this is just one piece of the puzzle. Joint mobilizations are effective for treating pain that's associated with the joint. Just like we might do manual therapy or massage for muscle pain, joint mobilizations have a powerful impact when we have joint pain. Joint pain is what we lots of times will describe as a crick in the neck, or maybe you have a sharp or a pinchy type pain when you move. This is generally joint pain, and adjustments, chiropractic adjustments, have a great impact on that type of pain. Number two, soft tissue treatments. So if the pain generator, maybe it's the upper trap, the levator scapula, these muscles that often we have knots and trigger points in and create a lot of workplace discomfort, we're going to target that with manual therapy, with maybe Graston therapy, or what we call instrument-assisted soft tissue management, maybe cupping, maybe dry needling. There's plenty of tools out there that allow us to specifically target soft tissue pain. Number three here is education and exercise. So this is extremely important. So we're going to spend time educating you on perhaps the reason why you develop neck pain in the beginning and what you can do to prevent recurrence of neck pain in the future. Also, we want to always prescribe some active care, some exercise. This is what allows us to, for one, more quickly recover from our neck pain, but also exercise allows us to build resiliency to the muscles of our neck and our shoulder to allow us to tolerate more and more stress without having an aggravation. So exercise always a big component of treatment. Number four, these are the four things you can do today to improve your neck pain. Number one, improve your workstation. So one thing you can do quickly is if you have a computer that's left-sided or right-sided facing, we know that's going to increase your chance of having neck pain. So you want that computer directly in front of you and ideally close to eye level. This is one way to immediately impact the stress that you're putting through your neck. Number two, frequent micro breaks. So this could come in many forms. You could stand up and just do what we call a Brugger stretch, which is kind of the opposite of sitting. We just do full body extension. You could stand up and go on many short, frequent walks to allow you to get some movement through the system. You could have a sit-stand workstation where you sit for 30 minutes, stand for 30 minutes, or some combination of each to allow you to push that cumulative seated time under that 6-hour mark. This will have a positive impact on your neck pain. Number three, healthy stress control. So many of us in these high stress jobs, we're kind of constantly stuck in what we call the sympathetic mode, which is that fight or flight. So we're always kind of wired, and this will increase your pain. So we want some sort of tool, whether it's breathing drills like box breathing, whether it's yoga, whether it's exercise in general, running. We need some sort of tool, yoga perhaps, to push us into the parasympathetic state throughout the day, to put us in that rest and relaxation state, and then in turn help to manage our stress and improve our neck pain by doing so. Number four is just to improve your range of motion. So again, through maybe some sort of stretching program, through yoga, you want to make sure you normalize your cervical or your neck range of motion so that you have a full range of motion, because again, that does directly correlate to the probability of having neck pain in the future. So hopefully that gives you a quick overview of neck pain, some healthy tools that you can utilize to start to feel better quickly. And should you be currently dealing with neck pain, or you dealing with neck pain in the future and you want to speed up that recovery process, please call us. Don't hesitate. Reach out. We are now open in Gate Village 2 and DIFC. We are treating DIFC's busy and active population out of Gate Village 2. We're also still open, obviously, in Al Wasl Road in Jumeirah at our main branch. So don't hesitate. Reach out. If you have any questions, shoot me an email, drop a comment, and I'll get back to you as soon as possible. So thanks for your time. Thanks for listening.